Hey everyone, and welcome. So you're an international medical professional and you're thinking about working in Germany? Well, you have come to the right place. Today, we're going to break down one of the most important steps on your journey, the medical language exam.
Okay, let's dive right in. The big prize, the ultimate goal for so many of you, is the German medical license. It's called the Approbation. Think of it as the master key that unlocks your entire career in the German healthcare system.
You've got the skills, right? You've put in the years of training. You've got the drive. But what's that one thing standing between you and your first day on the job in a German hospital or dental clinic?
Well, it all boils down to communication. It makes sense. To keep patients safe and to make sure you can work with your colleagues, Germany needs to know that you can handle yourself in a medical setting. And they do that with one specific exam.
And this is it. It's called the Fachsprachprüfung, or FSP for short. Now, this isn't your average German test. Not at all. It's a highly specialized exam that's all about how you communicate in the real world of medicine. And let me be clear, passing this is an absolute must-have to get your approbation.
Now look, I get it. Hearing about a big, important exam can sound a little stressful. But, the best way to get over any hurdle is to understand it first. So let's pull back the curtain and see what this thing is really all about. And this, right here, is probably the most important thing you need to hear. This exam is not trying to trick you or retest your medical knowledge. The people grading you already assume you're a good doctor or dentist. What they really care about is your language. Can you communicate clearly and effectively in German? That's the whole game.
So how much time are we talking about? The whole thing is just 60 minutes. That's it, 1 hour to show them what you've got. And they break that hour down really nicely into 3 manageable 20-minute chunks. This structure is actually great because it lets you focus on one single task at a time without feeling overwhelmed.
All right, let's get into the nitty-gritty. We're going to look at what actually happens in each of those 3 parts. Because while the overall flow is the same for doctors and dentists, the actual tasks, well, they're a little bit different.
So here they are, the 3 pillars of the FSP. First, you talk to a patient to figure out what's wrong. Second, you write it all down. And third, you present the case to another doctor. See? It's basically a perfect simulation of what you do on a normal day at work.
Okay, let's zoom in a bit here because the details are super interesting. For the doctors, in that patient interview, you have to use simple, everyday language. They are literally testing to see if you can avoid confusing patients with medical jargon. Then you write the formal medical report, the famous Arztbrief, where you need to be precise. Finally, you present that case to a senior doctor. Now, for the dentists, it's a similar vibe. You'll talk to the patient, maybe explain a procedure. Then you'll fill out a specific dental form. And for your final part, you'll probably have to describe an OPG, that big panoramic dental x-ray, to another dentist.
So now that we know what the exam looks like, the big question is, how in the world do you make sure you pass? This is where we shift from just knowing about the problem to actually finding the solution.
And here's the absolute truth of it. Just being good at German isn't enough. You could have a C1 certificate and still struggle with this. Success on the FSP comes from preparing specifically for this exam, its format, its vocabulary, its unique challenges. This is exactly why specialized prep courses are such a game changer. They put you in realistic exam situations, often with actors playing the patients. They drill you on the exact terminology you need. The instructors know this test inside and out. And because the groups are small, you get tons of personal feedback. Best of all, they're designed to meet the official standards for every single state in Germany.
So, what happens when you prepare like that? Well, a number like this, it kind of speaks for itself, doesn't it?
That's right, an almost 100% pass rate. This just proves that the right preparation makes all the difference. You're not just learning the language, you're learning how to beat the test. It's a strategy, and it clearly works. And the great news is there are tons of ways to do it. It's not one size fits all. You can do a super focused 4-week course, a longer 8-week one, or even a Saturday course if you're a dentist. There's private tutoring, online classes. Basically, you can find a format that's going to fit your life and how you like to learn. All right, to wrap things up, let's get all the practical, must-know info in one place. Think of this as your cheat sheet for planning your next steps. Okay, here we go. First off, your ticket to even sign up for the FSP is a general B2 or C1 German certificate. The exam itself is run by the state's medical or dental chamber, the Ärztekammer. Cost-wise, you're looking at around €450, but a little pro tip, always double-check with your specific state because the fees can change. The grading couldn't be simpler, it's just pass or fail. And here's the best part. If you don't pass on your first try, it's not the end of the world. You can take it again, usually as many times as you need.
So there you have it. The path is pretty clear. The Sprachprüfung is definitely a serious step, but it's a challenge you can absolutely overcome with the right game plan. The real question isn't whether it's possible, it's what's your first step going to be.